Hello everyone and welcome to Ama's Voice. I am so excited because this is the first episode of Ama's Voice. I am your host, Christian Victory Chemaka. Today we're going to be on the health corner and I have with me in the house on this show a very important personality, Dr. Chieme Ogumka. Dr. Chieme Ogumka, you're welcome to the show.
Thank you very much for having me.
You're welcome. Today, we're going to be talking on a great, important topic. According to Sub-Saharan African Journal of Medicine, following a review of pop-based study on DM in Nigeria by the Harati Aliyu, AA Shehu AU, stated that Nigeria has the highest population of diabetes mellitus patients. So today, we'll be explaining to a layman's understanding what diabetes mellitus mean, the causes, the types, and everything you need to know. Now I want to hand you over to Dr. Chieme Ogumka to explain further on this topic. Hello, doctor. Please, can you explain to us in simple terms what diabetes mellitus is all about?
Okay, thank you. Diabetes mellitus is caused by the way the body responds to blood sugar level. So I won't go into the use of big medical words so that people understand it very well. So when we eat, actually, the body produces what we call sugar. And it's from the breakdown of whatever we have eaten, especially from carbohydrate. And usually that sugar is converted into fats in our body. So a situation where the body cannot be able to convert that sugar that is produced from what we have eaten into fats, then it will become increased in the blood and will cause so many symptoms in the body. So that's what diabetes is all about. So the body's inability to regulate the blood sugar that is produced after a person has eaten is what we know as diabetes mellitus.
Wow, that's very educative. I actually learned during my study on this topic that there are types of diabetes. So what can you say about that?
Yes, that's very true. There are several types of diabetes. So, but we have the popular ones. We have two types: type 1 diabetes, that is formerly known as insulin-dependent diabetes. Then there is also type 2 diabetes that was formerly known as non-insulin dependent. I'm going to explain that in a short while. Then there is also what we call gestational diabetes. That is the one that is found in pregnant women and a whole lot of others. So, but the most popular ones are the type 1 and type 2. So type 1 was called insulin-dependent diabetes because for you to treat that particular type of diabetes, you have to use insulin. You cannot use drugs. It's mainly insulin, injectable insulin. So that's why it's called insulin-dependent diabetes. And the reason is because in that type of diabetes, there's what we call the islet of Langerhans, where pancreas is found in the pancreas that produces insulin that is used to bring down sugar level. So usually in type 1 diabetes, patients' beta cells are destroyed, so they are not able to produce insulin.
Wow.
So that is why they will depend on external insulin. While in type 2, is as a result of so many other factors. Insulin is actually produced, but the receptors that are responsible for the insulin reaction is not sensitive to the insulin. So when insulin is released, it won't have effect. Then the other thing also is that insulin is produced, but it's not properly secreted to the receptor sites. So that's the difference from the type 1 and type 2. And for type 2, you can use insulin. You can also use drugs for the management.
Okay, you talked about gestational diabetes. That's also a type of...
Yes, okay, for gestational diabetes is defined as blood sugar level that is high at pregnancy. So meaning before pregnancy, the person's blood sugar was actually normal. So but it became high during pregnancy. So that's the definition in a simple.
Wow, that's actually great. We're learning something here today. Okay, what's the causes of this disease? What are the risk factors, the causes of this diabetes mellitus we're talking about?
Okay, there are several causes or risk factors of diabetes, but in this environment, for us in the hospital, when patients come that have already developed complications, they will begin to say it's attack, and they are associated to several diabolic things. So, but the most popular risk factors is age above the 40 years. So people who are above 40 are at risk. Then the other thing is those who are overweight, or what we know as obese people. So they also are at risk. People with hypertension or blood pressure of 140 over 90 are also at risk. Those whose family there is diabetes in their family, possibly mom or dad or siblings, they are also at risk of having diabetes mellitus. Then race also is one of the risk factors. People who are from the European origin, African Americans, are also at risk. Then there is also what we call polycystic ovarian syndrome. That's peculiar with the women. So women who have polycystic ovarian syndrome are at risk of developing diabetes. So those are the major risk factors of causes of diabetes mellitus.
Okay. Can we actually know how this disease can be diagnosed? Because some persons out there might just feel, okay, because I've been emptying my bladder since morning, maybe I've gone to ease myself for more than 2 times since today, that means I have diabetes. I actually hear people saying that. Are you sure you don't have diabetes?
Okay, there are several ways that we can use to diagnose diabetes. First of all, if a patient presents to us in the hospital, we do our what we call questioning of the patient. So you ask patients a lot of questions from family history, lifestyle, and all of that. Then you also will ask the patient symptoms that the patient is having, and we have a whole lot of symptoms, but the popular ones is what we call the 3 cardinal signs of diabetes, which is excessive urination, especially at night, called polyuria. Then there's also what we call polydipsia, that's excessive thirst. So the patient becomes very thirsty and will require drinking of a lot of water. So which will result to increase urination, because the more you take water, the more you want to go to the toilet to urinate.
Okay.
Then the third one is excessive consumption of food. So you eat too much, and that will also is one of the symptoms. Then the fourth one is weight loss. So patients are also prone to weight loss. Then we have when it has advanced so much, there will also be other physical manifestations that we see and we will know. So from signs and symptoms, you can begin to think, oh, this could be diabetes. So it will now help you to know the lab investigation you're going to ask the patient to do. And there is what we call fasting blood sugar. So it's one of the tests we request for a patient to do. And when the result comes out, it's expected that it should be less than 7 millimoles per liter. So if it's above 7 millimoles per liter, then we'll start thinking, correlate it with the signs and symptoms the patient presented with. Then the other test we also request for is random blood sugar. So it's regardless of whether the patient are eating or not, you just do the test. And we also have the one we call 2 hours postprandial, meaning you take the sample 2 hours after the patient have eaten. So do these 3 basic tests. When they come out, you analyze them and correlate it with the signs and symptoms that the patient presented with. So it should be able to give you an idea, or it should be able to make a diagnosis of diabetes mellitus. So for that is very basic, but there are also advanced investigations that we do before we can be able to make that. But very basic is the fasting blood sugar and the random blood sugar with the signs and symptoms.